Good morning and welcome to the the Local Choice Datasheet Forum. Thank you for taking the time out of your busy schedule to join us this morning. My name is Elizabeth Dessenberg and I'll be one of your facilitators today. Our webinar this morning is scheduled from 10 a.m. to 12 p.m. and we have a lot of helpful content to cover. Today we are in the room with some Cardinal Benefits support team members as well as the folk from TLC. So let's head into today's agenda. So first we'll start out with an introduction from TLC, and then we'll move in to the TLC datasheet. We'll cover the new datasheet features, some important contacts page for TLC, and the new TLC report. Following that, we will have a quick demonstration, and we will have a recap of that demonstration that entails the updating and certifying of the TLC datasheet. After that, we'll have some Q&A following a support resource section where you can follow any support resources to help you as you complete this. And then after that, we will conclude this meeting with a meeting wrap-up where we can answer any lingering questions you may have or provide any support resources that you may need. Without further ado, I'm going to pass it over to Shelley from TLC.
Thank you. Good morning, everyone. This is Shelley Roselle. I'm the program manager for the TLC program. I just have a couple of reminders and then I'll turn everything back over to the Cardinal team. So the first reminder, this is the forum solely dedicated to the discussion and training on the local choice data sheet. If you have any questions regarding policy and provisions of the program, please send those to the TLC policy at dhrm.virginia.gov. And I will respond, or a member of my team will respond as soon as we can. As a reminder, the regional meetings are being held and they're going on right now. We will be headed to Southwest Virginia coming Monday, so we'll be there for 3 days. I look forward to seeing everyone down there. And if you have any questions regarding anything regarding TLC, please go to the TLC website under Group Benefits Administrators tab, Communications, BA Memos, and that's where we have the schedule of the TLC regional meetings. So I just want to remind you of the data sheet timeline. I've talked about it in the last couple of meetings. So just as a reminder, your certification is due Monday, April 1st if you're a July group. If you're an October group, stay tuned. We will communicate further details to you at a later date. Thank you for your time, and I'll turn it back over to Cardinal.
Good morning. As you get started with your annual data sheet activity, here are some reminders about accessing the Cardinal application. If you need more details, please see the appendix on security and access at the back of your presentation. Cardinal is accessed over the public internet. The URL is my.cardinal.virginia.gov. We recommend you test your access to Cardinal as soon as possible, not only to ensure you can access Cardinal, but also to ensure you have the proper permissions to enter and certify the TLC datasheet. Once you successfully access Cardinal, check to make sure you can navigate to the TLC datasheet using the following navigation path: Menu, Benefits, Employer Information, TLC Datasheet. If you can successfully navigate to the TLC datasheet, you should be able to perform your TLC datasheet activities. If you cannot get to the TLC datasheet, you do not have the proper access. Please submit a locality security access form as soon as possible directly to the TLC group at DHRM. Please don't wait until the last minute to check your access and permissions. If you do need to submit a new security form, you'll need to allow several days for the form to be reviewed, approved, and processed. We recommend you submit this form no later than March 22nd, although earlier submission is certainly encouraged. And finally, if you are tired of losing core user access, Please remember to log into the Cardinal application at least once every 90 days. This will ensure your core user access remains active. Okay, I'm now going to turn it over to Sarah Harrell.
Good morning. Thank you all for joining. We are going to go through some items in the data sheet together. First, I want to talk to you about the changes that we've made. This year, when you go into the data sheet, you don't need to add a new row. In the past, you would have to come in here and click a plus button to add a new row every time you needed to make an update. We have removed that. So when you come into the data sheet, you'll be able to just begin making your changes. You also have an option to save your data sheet and come back to it at a later time, as long as you haven't certified the sheet. But we'll go through and practice all of this together. There's a new ACA reporting indicator on the data sheet. You'll use that to communicate if Cardinal is producing your ACA forms at the end of the year. We'll see that when we do our demo. We've also added some new informational messages to the data sheet, and we'll trigger those pop-ups to help you see them in our demo as well. Finally, we have a new comment field at the bottom of the data sheet for you to summarize changes you've made and communicate that back to the TLC group. We'll look at that when we do our demo. And if you have no changes to make, you can just enter no changes in that box. We also have a new TLC contacts page. Previously, you accessed your contact information through a link on the data sheet. This now has a new page, which will allow you to update your contacts at any time. It'll no longer be tied to your renewal date. We have a new TLC data sheet report that you can run from the system. It looks just like the PDF that you're used to receiving from the TLC team in the past. We'll run that report together and take a look. We're about to log into Cardinal and walk through our demo. Before we get started, I just want to give you a few hints. First, we're going to go through this certification and update of the data sheet process 3 separate times. So you'll have plenty of chances to see this. We recommend that you just watch the first one before entering any questions. I'm also going to give you a little preview of what's coming up in the deck. If you've printed your copy out, you'll notice that the next few slides include information about the sheet and how to work through it. This would be a great place for you to make notes on your slide deck as I'm walking through the demo. Once we've done our 3 demos, we'll go through these slides together as a recap. We're going to switch screens so that we can pop over into Cardinal. All right, so I am currently logged into Cardinal as a TLC user. So we're going to navigate to the data sheet first. To get there, you're going to click the compass and the top right icon. Now, this is what Dana was referring to about access. If you don't see this compass, then you have lost your core user access. When the nav bar opens after I've clicked on the compass, we're going to pick menu. It'll bring my full menu up. We're going to select the benefits folder from the menu. Next, we'll select the employer information menu. And you'll see we see TLC contacts, that new menu item we talked about, the TLC data sheet, and the TLC report. Let's start with the data sheet. When you get to the search page, you can simply click the search button. If you only have access to one group, it'll bring your page right up. If you have access to more than one group, you'll see both or as many as you have access to returned, and you can select the one you'd like to work first. So let's take a look. As you can see right now, we are on our 7/1/2024 data sheet row. Make my screen a little bigger for you. All right, the top of the screen includes details about my group. So the group that we're going to test with today, and again, we're in a test environment, so this is all test data. We're going to test with the Roanoke River Service Authority data sheet. It's a government type and their renewal period is in July. These fields are grayed out. If you needed to make a change to any of this information, you would need to reach out to Shelley's team at the TLC box. You're going to come in and enter your total number of employees enrolled and your total number of employees waived. You're going to check the box if you're using premium averaging. You can see this is our new TLC ACA reporting indicator on the sheet. You can pick yes, my reporting agreement is on file. No, we are opting out of having Cardinal produce our ACA forms this year. Or no, we are not using Cardinal for ACA forms because you did not participate in a full year. You were a partial year participant. So let's go ahead and say yes, this group is going to do their ACA reporting through Cardinal. As I scroll down, you can see the plans that are currently being offered, right? If you look at the benefit plan, if you look at that character in the middle, that gives me a hint as to who this plan is eligible for. So this plan is 210F, that's a full-time plan. Full-time plan, and then they're offering 1, 2, 3 retiree plans, okay? All of these plans get pulled in based on what you offered in your data sheet last year. Most of you are going to come into your data sheet, and the only real change you're going to need to make is updating the rates for the current year. So let's do a data sheet like that. We're going to scroll down to the rate section. You'll notice there used to be a contact link here that has been removed. It's now on the separate menu page. So let's click our rates. The amounts that are going to come up are the new rates that have been pre-populated by the system. You'll need to come in and key an employer rate for each of these plans that you're offering. You'll note the total rate is already populated. As you key in the employer rate, the employee rate is going to update automatically. When I look at this MEC rate column, this is telling me what my minimum employer contribution is to offer this plan. So to offer the Key Advantage 250, the employer must cover $544. So let's say we're going to cover $550 for this plan. When I tab out of that field, it updates the employee rate. The difference between, the total rate and what the employer is covering gets updated automatically. You can also see that it updated the MEC for the other coverage levels. So if you're going to pay $550 on the employer for employee only, you must offer that same amount or greater for your other coverage levels for that same plan. We'll key the $550 here. Oops. All right, I've finished keying the 4 rates for this coverage. Let's go to the next one. Now when I go to key for Key Advantage 250 with preventive dental, the MEC is a little bit lower. I can key a 530 here, that'll be above. And again, it's going to update for the other coverage levels. So I know I have to cover the same amount for these plans. I can choose to key a higher amount if I'd like to cover more. For simplicity's sake, we're going to use that same rate for all of them. And I'm actually going to go in and key this one a little bit under so you can see what happens if you don't. Next are the rates listed for our retiree plans. This employer is not going to contribute to the retiree plans, so we'll leave those rates blank. I'm going to say okay because I've keyed all of my rates, and the system is going to stop me. It's going to highlight that 529 in red. The rate that I entered was less than the MEC. I know which plan I didn't get it on because it's red for me to come back to and find. So we'll update this to 530. We'll scroll back down and say, okay. All of my rates have been entered. Let's take a look at the class that we're going to offer. So this is the different types of employees that we are offering coverage to. I always like to click View All here so I can see them all at once. So for this upcoming plan year, we're going to offer COBRA coverage. We're going to offer early retiree non-Medicare coverage. We're going to offer coverage to our full-time employees, our Medicare retirees, And then we're offering retiree survivors, Medicare and non-Medicare. We're going to offer split contract for dependents of retirees. This is when your retiree is on a Medicare plan, but they have dependents who are not. So you'll have plans that you can offer them. And they are offering the extra month of coverage. We're not going to make any changes to our employee classifications this year. So we'll just say, okay. Now I'm at the annual changes. This is a new field we mentioned that you would see on your sheet. This is where we want you to change, let us know about any changes that you've made. So if you've added or removed a class, or if you've added or removed a plan, this would be the place for you to communicate that. On this sheet, all we did was update rates, so we'll enter no changes. We'll sort of go back, take a quick look, right? We've answered our ACA reporting. We've got our employees enrolled information. We've keyed all of our rates. It's now time to validate our data. We're going to go ahead and click this button. And the system is going to tell me that my rates, plans, and class validations were all successful. I can now certify this group by clicking yes in the certification area below. We'll say okay. So again, as we said, most of you are going to come in and you're really only going to have changes to make to your rates. So this is the demo of just updating our rates. We'll look at some more complicated situations next. But this TLC has got their rates in, they've confirmed their plans and their classes. They are ready to finish this data sheet. We'll update the certify information to yes, and we'll save the page. So this data sheet is now certified. I'm going to go back to the search information and pull up my data sheet again. You'll notice now when I come into the data sheet, all of my fields are locked down. When we came in first, we were able to enter in total number of employees. We were able to update our ACA reporting. This time, I can't make any changes to the sheet because I have certified. So don't certify until you're completely set with your sheet. Once it's certified, any changes would have to go through the TLC group. Now that I have my sheet certified, let's run the new TLC data sheet report. I'm going to click on my nav bar compass. I'm going to click on menu. And I'm going to click on the TLC data sheet report. As with any report you're going to run in Cardinal, you're first brought to this select a run control ID page. Later on in the deck, we have links to our job aid that explains how to run a report if you haven't done this before. Typically, when you get here, you can click the search button to see if you have an existing run ID. I did. I have a run ID that I've just called number 1. When you get to this report for the first time, you may not find anything in those results. That's okay. Just click on the add a new value and let's create a new run ID called 2 and add that. This is the page I'll use to generate my data sheet report. I only have access to one group, so I'm going to pick all groups. I'm going to click the run button. You're brought to this page where you're actually going to submit your request to run the report. You don't need to change anything here, just accept all of the defaults and click OK. I know my report is running because I now have a process instance shown on the screen. To get to my report, I'm going to click on the process monitor. And you can see that my report has run this morning successfully. I'm going to click on details. I'm going to click on view log trace. The PDF contains my report. Again, if this is new to you, don't worry. All of the steps are detailed out in the running a report job aid that is linked later in this deck. I'll click the PDF to open it, and you can see that my PDF has been produced. And it's the same PDF you should be familiar with. So it goes through and it talks about all the classes and what their billing methods are, what my waiting period is. It's got the plans that I'm listing. It lists out the plans that we're offering to our employees this year. It includes, whoops, our rate information. It includes our ACA reporting information. It confirms our open enrollment dates. And then the last page is just going to show my certification status. All right, and so you can print this for your records as soon as you've certified your data sheet. So let's now navigate to the contacts page. That would be the next thing you'd want to check after you finish your data sheet. So again, we're going to go to our compass to pull up the nav bar. We'll click on the menu, and TLC contacts are right here. I'm going to click the search button, and it's going to pull up the 4 different contact types that I can have for my TLC group. Every TLC group will have these 4 contact types. You may have one employee filling all 4 of these roles, or you may designate different people for the different roles. So let's say Betty Benefits is no longer our benefit administrator contact for this TLC. I'm going to insert a new row. And let's say we know this change happened, on 3/1. We'll update the date. We can do that manually by clicking in the field, or we can click the calendar icon and picking that date. I have 2 options. If I know the employee ID of the user that we want to be this contact, I can key it in this box, or I can manually type their information in. So let me just grab a ID that I can put in so you can see that. So I'm going to paste that EIN in and search for that person. And we are switching from Betty Benefits to Brian Benefits as our new benefit administrator contact. You can see that automatically brought Brian's name in. It brought in Brian's email. If I don't think this is the right person, I can clear this out and pick a new employee. But I think Brian is the right guy for the job, so we'll go ahead and select him. The mailing address and the shipping address are going to copy from the previous row. So we've had no changes to our building location, so those are all going to stay the same. And now I can save this change to the contacts. There is a job aid out that steps you through making changes to your TLC contacts. That's also linked in this deck for you. Again, I could put in any date I needed to make this change. I don't have to tie it to the TLC data sheet any longer. So whenever you have a change to your contacts, you should come in here and make those updates. All right, if I return to the search, I can pick another contact. We've got our benefits executive tied to human resources, Harry. If we needed to make a change, we could insert a new row, change the name to benefits Brian, type in his email address. All right, let's say there was no change to the phone number. Address was pulled in from the prior row. We've had no changes to our building, so we're going to keep that and save. All right, so now those TLC contacts are completely separate from your data sheet. You can update them at any time. And again, we do have a job aid detailing how to come in and make these updates. So if your TLC is only going to change your rates this year, we've just demonstrated that. You're going to pull up your TLC data sheet. You're going to key in the rates for this plan year. You're going to certify your sheet, print your TLC data sheet report, and then verify your contacts. Let's stop and assume that we have some more changes that our data sheet to our that our plan or offerings for this year. So I'm going to sign out as this employee, and I'm going to log in as another employee, and we'll step through now a more complicated test scenario. All right. All right. All right, so now we're in the system as a different user. Again, I have my core access because I can see my icon in the top right corner. We'll click on our compass to pull up our nav bar. We're going to select the menu. We're going to select the benefits folder and employer information. I can go in and take a look at my contacts. I can pull up my TLC data sheet, and I also have access to run my report. So let's go into the data sheet. I'm going to click search. It's going to pull up the one sheet I have access to. I know my count has changed, so we're going to make this 500 employees enrolled with the same amount waived. We are going to use Cardinal ACA reporting again this year, so we'll key that reporting indicator. This TLC is offering a few more plans than the one that we looked at previously. From a quick glance, I can tell that we're offering full-time plans. We are offering part-time plans. And we are offering retiree plans and retiree Medicare plans. All right. Let's decide for this TLC that they are going to offer a new HMO this year. I'm going to click the plus button, and I'm going to get one of the new warnings we've talked about. It's going to tell me that, hey, you're about to add a new plan. Once you've added the plan, you need to review your employee class list to make sure that you have a class that matches to this plan. Okay. We'll say, okay, we understand. We'll click the magnifying glass so that we can see the list of available plans for us. Let's decide to offer the Kaiser HMO to this group. I'm going to select the Kaiser HMO full-time plan, and I can tell that because it's got that F in the 4th position. We're going to go ahead and also we have to offer this plan to all of our employee types. So we're going to add the part-time Kaiser HMO. We'll just scroll a little further. And now I can see here is the Kaiser HMO with a P in that 4th position. So we'll pick that. And we also need to add it for our retirees. So we'll add it one more time. We'll see our morning message. We'll note that, excuse me, after we've added this plan, we're going to go take a look at the rates and classes. We'll scroll through our list to the R plans, and we'll select the Kaiser HMO for the retirees. All right, we've got these 3 new plans. Let's take a look at our classes. Again, we're going to click that view all so we can see them all at once. And you can see, yes, we have a class showing that we are offering coverage to full-time employees, part-time employees, and retirees, right? We've got those early retirees, non-Medicare listed there. We don't need to make any changes to the employee classifications in this instance because we are covering all the classes for the plans that we've selected. We'll say okay, and we'll take a look at our rates. You can see that the rates are getting populated based on the plans I've selected. So all the plans I added, all the plans we covered last year are listed in this rate sheet for me to key, and the new HMO is also here for me to key. So let's get to work keying in some rates. We know we have to have a rate in there for plans that have an MEC. So this first plan, this full-time plan, its MEC is $722.40. So I know my employer contribution must be higher than that. Let's key an $800 contribution. As I tab out, you can see the employee rate went down. You can see the MEC for employee plus spouse for this plan is higher than that $800. So it was not defaulted to that. It's set to $952. So let's key a $955 here. We're going to key $1,200 here. We're just going to keep these above, right? we saw earlier, if I try to key something below, then I'm going to get an error when I try to save. So let's just quickly add in some rates. We're just going to go down the list for any plan that has that MEC populated and key a rate that's equal to or higher than that rate. All right, we'll keep keying these rates as we go. All right. Just got a few more to key here. Oops, I keyed in an inappropriate number. So the system will catch that right away and get me to make a fix. Okay. We'll key in the rates for our part-time population if we're going to subsidize that. And you can, type in that box and just tab out of it, and it will take you to the next field that you need to do data entry in. Oops. We're going to continue down our list and get all of these rates keyed. We're going to keep an eye on that MEC field to make sure that we're staying above that or equal to it. And then in a second, we're going to take a look at the new feature where you can leave the sheet and come out of it again. So we'll continue to key these rates. This one's got a lot of rates to key. All right. I'm in my retiree section, so we're going to leave those blank. And we're going to come down to the bottom of the list where we've added those new HMO plans. So let's key rates there. Almost done. All right. I think we've keyed a rate in for each of the plans that's higher than that MEC. Let's click OK to see if we did. Rate entered as last. So let's see which one we missed it on. We'll scroll up and look for the red rate. Up right here, I keyed 550 on a 553 plan. We'll make this 555. And we'll say OK. We must have missed another. It'll tell me at that point. I can scroll up and see that one. We'll say OK. All right, I think we've fixed all of our low rates. Yep, it was happy with that. So let's say at this point, I want to save my sheet, take a lunch, right? Information has not been certified. Am I good to do that? Yep, we understand. We are still working on this sheet, but we want to save our progress, okay? So we are going to save that sheet, walk away, right? And then we're going to come back into the sheet. Let's say we had time to talk with our coworkers and our team. You can see I'm back in the sheet. I still see my HMOs, the part-time, the retiree, and the full-time. They get reorganized and sorted by that benefit plan. So all of my full-time plans go together. I can still make changes to this sheet. I don't need to insert a new row. I don't need to reach out to any help boxes. I haven't certified yet, so I can make changes to this sheet. Let's say after careful consideration, we decide we don't want to offer the HMO this year. I'm going to come in and say, okay, well, let's get rid of this plan. Let's click the delete button. It's going to say, are you sure you want to do that? Yep, I'm sure I want to do that. And it's going to say, ooh, you can't delete that plan because you have rate information for that plan. Ah, that's right. And the TLC data sheet job aid talks you through this. If you want to get rid of a plan, you have to first come into the rate section and remove the rate you've keyed for those plans. Otherwise, when we load all this information into the system, we'll end up loading rates for a plan that you don't offer, and that will cause some issues. So we're going to come in here and we're going to find those HMO rates that we keyed, and we are going to set them to 0. You can come into this box and click delete and just get rid of it, right? You can set it to 0 and tab out. It will clear it out. So you have options here. Let's go ahead and delete all the rates that we've keyed for the Kaiser full-time plan. We know that if we're getting rid of it at the full-time level, we're also getting rid of it at the part-time level. So we'll scroll down, and I know this is my part-time Kaiser HMO because of the P here. Let's delete this rate. I can tab to get to the next one. All right, now we've deleted both the full-time and part-time rates. We didn't key any rates for the retiree plan, so we don't need to delete anything there. We'll say okay. It's going to warn me, hey, you've got the rate set to 0 for a plan that does have an MEC. And we're going to say, yep, we understand that. We set that employer contribution to 0, which is below the MEC because it's our intention to delete the plan. We'll say okay. And now when I scroll up to my plan section, I can say, let's get rid of the Kaiser HMO. Are you sure it's going to ask me? Yep. I'm going to get at one of our new warning messages. You are about to remove a plan. Please confirm that your selection by clicking OK below. Once you've removed that plan, make sure your employee list is still in line. All right, so we're going to say OK, and we know we're going to go check the classes before we finish working on this sheet. I'll scroll down to find my part-time, right, the P in this character, HMO, and I'll click delete. Because we've already gotten rid of the rates, we won't get that message again, but we will get our warning message saying, hey, you may need to check your class list because you're removing a plan. Understood? And now at the bottom, we'll find our retiree version of that HMO, and we'll delete that as well. Same warning message. Yep, we've got it. So now if we look at our plan list, we can see we are offering full-time plans, part-time plans, and we are offering, sorry about that fast scroll, we are offering retiree plans and retiree Medicare plans. So let's take a look at our class list and see if that matches. Again, when you get in here, clicking on that view all link is helpful to see everything at once. So let's take a look. COBRA, early retirees, full-time, Medicare retirees, part-time. We do have plans that match to all of these classes, so we don't need to make any changes here. We'll say okay. Now in the annual changes, we didn't make any new plan changes, right? We thought about adding an HMO, but we didn't, so we don't need to report that here. We've keyed all of our rates. We didn't need to add in any employee classes, so we're going to say no changes, and we're going to validate our data. The system's going to go back through and it's going to say, oh, you've got a missing rate issue. So let's come in and take a look at the rates. Everything looks good there. Let's say okay. Oh, we're missing an MEC again. Here we go. That 955 I keyed on an MEC of 956. We'll make this 1,000 even. And the reason we're getting this now, we didn't get it before, is because I changed the total number of employees enrolled, and that impacted my MEC. And it's probably going to happen in a couple of places, so we'll go in and make all these changes, which is why we always ask you to click that Validate Data button right before you're about to certify. just take a look at these as we go, make our updates. I can see a few more it's going to want me to change. So let's go in and make those quick updates. All right. These all look higher to me, so I'm going to go ahead and try to validate. Oh, I see one here. Get this one up as well. All right, let's see if we've got all our updates in. It's going to tell me that you still have something in red to check, so we'll scroll back up. So I definitely keyed a wrong number there. All right, let's try. All right, all of our rates are now above that MEC. I've got my no changes in. I have validated my data, right? We click that, everything looks great. You can certify. We'll go ahead and say, yes, that we are certifying. And we are going to save the page. All right, and now that sheet has been certified. If I come back into the sheet, no changes, right? Because we've gone ahead and submitted that certification step. Everything is locked down for me. I can't make any changes. At this point, this TLC could go in and they could run their TLC data sheet report and they could check their contacts. We're going to look at one more data sheet scenario that you may run into before we do our overview and step out of the demo space. This time, our data sheet is going to have a mismatch between the plans offered and the employee classes offered. All right, so we are back in the system as another test user. We're going to navigate again. We're going to use that compass to get our nav bar menu. We're going to select menu. We're going to select benefits, employer information, and the TLC data sheet. When we get this search page, we can just click on the search and it'll pull up the sheet that we have access to. It's a brand new sheet. We haven't certified. All of the fields are open for data entry. Let's answer our ACA question. Yep, we'd like to have our forms produced out of Cardinal. Let's take a look at the plans that we're offering, right? We're offering full-time plans. We can tell that because the fourth character is an F. And we're offering part-time plans. We can tell that because the fourth character is a P. Let's take a look at the classes that we've got listed for our two departments. We're going to click View All. You can notice that we've listed that we are offering coverage to early retirees, but we didn't have any R plans offered. All right. We'll check for the other class list. And again, we say that we're offering for early retirees, but we have no R plans in there. Let's see what would happen if we just went ahead and entered rates and tried to certify this sheet. All right, so we're going to come in. Again, we're going to key all these rates and we're going to key them above that MEC value. Right, let's get Go through our list. We'll make sure that any field that has an MEC value gets a rate. That's a requirement. We've seen before, if we don't key that in or if we key it too low, the system will stop us with warnings. All right, so we've keyed rates for every plan. We successfully keyed them for this department. Now we have to come in and key them for the other department. All right, some of your setups, you'll see that you have more than one department under your group. So you'll have to come in and enter the rate information for each one. Go ahead and cut and paste this to get this a little quicker for you. Oh, that one I got an error on because I keyed in an employer rate that was higher than the total rate. We'll make this 525. We can paste that into the rates below. This one 400. We're going to key that same thing in. This one 300 now that we're in the part-time space. All right, let's say okay. Hey, we got them all great this time. I'm going to come down. I'm going to say we offered no changes, right? We didn't make any plan changes. We didn't change any of our classes. We just keyed our rates. We think we're done. Let's validate the data. Validation is going to say, hey, you've got a retiree class, but you don't have a retiree plan. So it's going to stop you at this point. And again, when we looked at those classes, right, we're going to view all. We've got retirees listed, early retirees. But in the top of our data sheet, when our plans are listed out, we have no retiree plans listed. So we need to add in our retiree plan. It'll warn me, hey, you're about to add a plan. You may need to update your classes when you're done. Okay, so we're going to scroll down. Again, it's you're looking at that benefit plan, that fourth character. So all of the full-time plans will be listed first, and then it'll transition to the part-time plans. And then finally at the end will be in the retiree plans. This last column is going to tell me, is this retiree plan a early retiree plan or is it a Medicare plan? So we didn't list Medicare as our classes. We're going to pick one of the other retiree plans. I'm just going to move this window over a little bit so I can see we are offering, Key Advantage 250 comprehensive. So let's offer that Key Advantage 250 comprehensive as a retiree plan as well. All right, so now I've added this plan here. I'm going to come in and look at the rates, and you can see that now that our plan is listed at the bottom. And if I want to, we can include, you would key the contribution there if it was needed. When I come to my other department, right, that retiree plan is now here. We'll say okay. So now we know that we've got this list of employee classes, right? Our COBRA, our early retirees, our full-time and our part-time for both of my departments. And that matches the plans we've listed above, full-time, part-time, and retirees. Let's try to validate the data again. You can see this time it's going to tell me, hey, you didn't put a summary in because I deleted that out, right? We have to have that summary to move forward. So we're going to say that we added retiree plans. Okay. Now let's try to validate our data again. So this time it says you did it great, right? You've got plans and classes all in line with each other. You have a summary and you've got rates that are above the MEC or equal to for all the plans that require it. We can say, okay. I can save this sheet. Oh, I was missing a plan, a matching plan, right? So there are rules about matching your plans, right? Shelley will get into that more at your regional meetings. But again, so I've got all my plans out there. I've got my rates keyed for them. I've got my classes in line. I can certify this sheet or I can save it and come back to it at a later time. So we're going to pause briefly and just sort of summarize what we've done. All right, here we go. So again, you're going to log into Cardinal. You're going to navigate to the menu item that we showed you about, right? You're going to use your nav bar by clicking on the compass. You're going to go to the menu, benefits, employer information, and then select that TLC data sheet option. That will get you right into your data sheet. You don't need to know your group number. You can just click the search button and it'll bring up, if you have just the one group, it'll pull you directly into that data sheet. If you have more than one, it'll only return the ones that you can go in and update. That group detail information is at the top, right? Some fields you can edit, some fields you can't. If it's a field that you can't edit, you would need to reach out to the TLC group. And we do have that job aid linked for you here that will step you through making all of these changes. You're going to go in and look at the plans. If you need to add or delete a plan, the system is going to step you through that, right? It's going to tell you if you're adding a plan to check your classes. If you're removing a plan, it's going to make sure that you delete out those rates before you remove the plan. All the plans that you are currently offering now will be populated on your data sheet. That happens automatically. So if you aren't changing your plans, if you aren't changing your class, all you're going to have to do is come in and key your rates for this new plan year. When you key those rates, be conscious of that MEC value. You saw it trip me up quite a few times, right? But the system will highlight those fields in red that it needs you to address. Check your classes, make sure that you have a class listed for each of your plans and all of your plans match your classes. Use that annual changes box to let us know we aren't going to offer coverage to a group this year. We're going to add a new plan, right? Any of that information should be communicated to us in that annual changes. It helps us to ensure that the system is set up properly so that when you go to key your open enrollment elections, the right set of plans are available. You'll use that validate button to go in and check. It will look at your plans, your rates, and your classes for you, and it will stop you if you are missing something. Once you've validated the data, you can go in and pick your certification radio button. If you're ready to go, move it to yes, and then click save. If you're not ready, just save the page, and you can come in until April 1st and get those changes in. We have our new contacts page that we looked at. Again, this is separated out from the data sheet now, so you can update it real time. The dates aren't tied to the renewal dates any longer. You're going to come in and just click that search button. It'll pull up your groups and all the 4 contact types per group. You'll add a new row to make an update. You can key the EMPL ID of the person, or you can just key in their name, email address, and phone number information. Some places are going to have one name listed for all 4 types. Other places will have more than one person listed. You can update that however it applies to your group.
Sarah, we do have a couple of questions about the TLC data sheet. One of them is, could you please remind me of what date we run the total number of employees enrolled and waived?
Sure, let's pop back over to the TLC data sheet. All right, so we are back in the system. And you're right, at the top section, we are going to ask you to enter in 2 counts, the total employees enrolled and the total employees waived. You're going to key that information as of current date. So whatever date that you come in to fill out your data sheet, let us know how many employees are enrolled in the total employees enrolled box. That's people actively participating in coverage. The total employees waived are those people who were offered coverage but declined to participate, right? So you have a person in your group, they could sign up for your plan, they have coverage elsewhere, so they did not enroll. That's what we're counting as a waive.
So I guess a similar question, Sarah, is if those two boxes are populated when I open the worksheet, do I need to change those numbers?
Sure. So these are going to be populated based on the last information you put on last year's data sheet, right? We try to pull forward everything from last year's sheet onto this year's sheet for you. And so if you had no changes in your enrollment between last year and the day you're doing this, you don't need to update those numbers. You may have had, your group may have grown, you may have a few extra total employees that got enrolled in coverage, so you may need to bump that up or bump it down. But unless something really big happened in your group this year, you would expect those numbers to be similar, and they may not need an update.
Okay, then we have a question about the rates. Do we need to be concerned about entering in the exact amount or just a higher amount than the MEC rate?
So we want you to enter in the exact amount that you are going to cover for your employees, right? So again, let's take a look at that rate information. All right, when I'm keying in that, that employer amount, right, as we change this from 770 to 775, you can see the total rate is 902. So it's going to change the employee rate to 127, right? And so this is we are expecting this to be the exact amount that you are going to cover as the employer. And where you will see this impact is that if you have any groups that are on direct bill, whatever that employee rate is, that's what they will be billed. Okay, so it is important to make sure you key what the exact employer rate that you are covering for each of these plans, that we have accurate rate information loaded into Cardinal, and it does impact the information we send on to vendors, and it can impact bills that employees who are direct bill will receive.
All right, Sarah, I have a couple of questions about the contacts page. The first one is, what do I do if I don't see my group ID in the TLC contacts?
Okay, so when I am logged in as a TLC user, right, let's cancel this change. I'm going to click on that navigation compass to pull up my nav bar, right? It's going to sort of bring me up to where I was before. So we'll click on the benefits folder. We'll come into employer information, and then we'll click on TLC contacts. Nope, let's not make any changes to our data sheet at this point. All right, when I click search, I should be returned any groups that I have access to, right? Remember that last sheet we looked at, there were 2 departments. And so when I come here as that user, I can see my contacts for Department 1 and Department 2. If you get here and you're clicking that search button and you don't get anything returned, you would need to put in a VCCC ticket, and we'll take a look at your security. But if you can get to your data sheet, I would expect you to be able to find your contacts on the contact sheet. And again, no need to do the lookup, right? Just click that search button and it will return what you have access to.
Okay, and the second question on contacts, can you have multiple contacts for the same contact type?
No. You have to pick one contact, one person for each of those contact types. I can tell you some of our larger groups use a distribution box, and that's what they put in as the email so that everybody who's on that distribution list gets the email. But it's a one-to-one. You can only put in one person, one email per contact type.
I think we're good for now.
Okay.
Thank you.
Dana, was there a question about a report?
Oh, yes, I'm sorry. Yes, could you please show the navigation to the employee enrollment report?
Absolutely. So if you're coming into the system fresh, you're going to, again, you click your little compass to get into the nav bar so you can navigate around. We're going to select the menu option. It'll bring up breadcrumbs at the top from where you were before. Let's say we're coming in fresh. We'll click menu to get us back to the beginning, and then the benefits folder, right? And then you're going to select reports. And then the Cardinal enrollment report is listed down here on the list. We'll search for an existing run ID. We'll go ahead and pick one, right? And now I can I can run the report from here. I can update this as of date and go ahead and run that report. So again, the navigation to that page is menu, benefits, and from benefits, you'll select the reports folder, and the report is called the Cardinal Enrollment Report.
And Sarah, is that the best report to find total enrolled and total waived?
Yes. That's going to show your whole population and their status for benefits.
Excellent.
Hello, everyone. This is Shelley Roselle. I just have a couple of updates based on the form and the changes. So the first thing, if you are desiring to impose a waiting period for new hires, please send an email to the TLC General Mailbox, tlc@dhrm.virginia.gov, and also to tlcpolicy@dhrm.virginia.gov. We will make that change for you internally and communicate that back to you. In the interim, if you're desiring to still go into your data sheet, please save it until we've made that change. And then once we've made it, you can go back in and certify it. The second thing for the TLC contact changes, this does not replace the current internal process that we have. So if you are updating any one of the 4 roles, I need you to continue using the TLC group data change form that's on the TLC website, and submit that to our office so that we can update those contacts and notify our vendor partners. And you can still do this step as part of your data sheet as well, but it does not replace the current process that we have in place. Okay, thank you.
Now we'll hear from Dana Smith.
All righty. As we always do, we'd like to remind you of the various support options you have available to you. Your first option is to contact the TLC group at DHRM. They can assist with questions and issues such as questions about the content of the TLC datasheet, changing the group details on the TLC datasheet, making corrections to the TLC datasheet after you certify, and any general healthcare plan and benefits questions. Their contact information is shown on the right-hand side of the slide. The TLC e-news is another great source of information. We've provided a link to that also for your convenience. Your second option is to contact the Cardinal Team by submitting a VCCC ticket using the email address shown on the slide. Please remember to include Cardinal in the subject line. The Cardinal Team can assist with technical issues such as problems with the page, other technical questions you might have about the Cardinal application, login issues, and support with Cardinal functions. How to submit a Cardinal Help Desk ticket. As I mentioned on the previous slide, if you need to submit a help desk ticket to Cardinal, please email vccc@vita.virginia.gov. This is our central help desk. To ensure the ticket gets properly routed to the Cardinal Team, please be sure to put Cardinal in the subject line, as well as a brief subject to aid in routing, such as TLC datasheet. Please also include as much detail as you can about the issue you're having, and include your locality name and 9-digit DHRM group number. Please also include your name, your email address, and a phone number where we can reach you. If you have any screenshots you'd like to share, we ask that you put them in a document and attach the document to the email, as opposed to inserting the screenshots directly into the body of the email. And please don't share sensitive personal information. Please make sure that is blurred or cropped out. We also ask you not to send encrypted emails, as our help desk system cannot accommodate those. And finally, please don't copy other mailboxes when submitting a ticket. Okay, let's talk about the Cardinal website for localities, which you can access using the link shown in this slide. The link contains lots of helpful links and information for our Cardinal locality users. A particular relevance to our presentation today are the 3 job aids listed here. We have our BN 361 TLC datasheet locality job aid, which provides detailed instructions on entering and certifying the TLC datasheet as Sarah demonstrated today. The BN 361 TLC contacts locality job aid provides detailed instructions on updating the contacts for your locality in the Cardinal application. And the NAV 225 generating an HCM report job aid provides instructions on running reports in Cardinal. This one might be useful to you as you run the new TLC datasheet report. We've also posted the forum presentation at this link. And as soon as we have the forum recording available, we will post that here as well. That will be most likely later this week that we'll have that ready for you. If we just want to remind you once again, start soon. If your locality has a July renewal, your data sheet entry and certification is due by April 1st. We really can't emphasize enough how important it is to test your access early and get started on this task. And please take advantage of all the support resources available if you need them. We have had quite a few questions about what roles to select if you do have to submit a new security form. The TLC group can help you with that, and I believe in the regional meetings that is a topic that is being covered, so stay tuned for that. Okay, at this time we really don't have any additional questions. If you feel like you do still have a question that you did not get answered today, please use the resources we provided to you, either the TLC mailbox or opening a Cardinal ticket. And we will be happy to assist you. We do thank you for your time today. We hope you found the information valuable. We'll talk to you soon, and until then, goodbye.